Medical necessity. What does that mean? Just because there is a fee associated with the code, that doesn't mean that the provider will be reimbursed. In order for a payer to reimburse a service, they must believe that it's medically necessary. It isn't always easy to define medical necessity, and oftentimes different payers will have different interpretations. Here's the CMS definition of medical necessity. According to CMS, the definition of medical necessity is services or supplies that are proper and needed for the diagnosis or treatment of your medical condition, that are provided for the diagnosis, direct care and treatment of your medical condition, that meet the standards of good medical practice in your local area, and that are not mainly for the convenience of you or your doctor. It's important to note that CMS has the power under the Social Security Act to determine if a service is reasonable and necessary. If Medicare or another payer determines that the service was not medically necessary and a payment has been made, the payer will demand that that money be refunded with interest. In addition, if it's determined that there is a pattern for billing for services that were not medically necessary, and if it's determined that the physician knew that it was not medically necessary, then the physician may face criminal charges as well as monetary penalties. Ultimately, it's up to the provider to document the medical necessity, but we as coders need to ensure that we're coding accurately based on the documentation available and to the highest degree of specificity. Under the Social Security Act, there are regulations that govern medical necessity. CMS develops policies based on items or services that are covered by the Act. CMS is not allowed to cover any items or services unless they have been put through the legal requirements. National Coverage Determinations, or NCDs, describe whether specific medical items, services, treatments, procedures, or technologies can be paid under Medicare. Each local MAC, or medical administrative carrier, is then responsible for interpreting those national policies into regional policies. These are called local coverage determinations, or LCDs. LCDs only have jurisdiction within their regional area. For instance, where I'm located in Idaho, the regional MAC is Noridian, so only Noridian LCDs are applicable to claims generated in this MAC jurisdiction. The MACs may also define what codes are needed for coverage in a related billing and coding article.